Today we will discuss the top 10 tips every parent needs for newborn jaundice that moment you see your brand new baby's skin turning yellow. It can be absolutely terrifying. You're already trying to figure out so much as a new parent, and now this. You're probably thinking, is this normal? Should I be worried? When do I call the doctor? First, take a deep breath. You are not alone. Jaundice is incredibly common, affecting about 60 of all newborns. Most of the time, it's just a normal part of the newborn process and goes away on its own. But, and this is a big but, in rare cases it can become serious. Knowing what to watch for is absolutely critical because high levels of something called bilirubin, which causes that yellow color, can be harmful if they aren't treated. In this video, we're going to clear up the confusion and calm the anxiety. We'll walk through 10 critical tips for spotting the warning signs that mean it's time to call your doctor or get immediate medical help. My name is Sarah, and I'm a pediatric nurse with over a decade of experience and a mom of 2. I'm here to give you the clear, straightforward information you need to feel confident and protect your little one. Section 1. What exactly is jaundice? Before we jump into the tips, let's get on the same page about what jaundice actually is. Jaundice is simply the yellowing of the skin and the whites of the eyes. It's caused by a buildup of bilirubin in the blood. Bilirubin is a yellow substance that the body makes when it breaks down old red blood cells. Before your baby was born, your liver did all that work for them. Now that they're here, their own little liver has to take over, and sometimes it's just not mature enough to keep up at first. This makes the bilirubin levels rise, causing that yellow glow. This physiological jaundice, the normal kind, usually shows up 2 to 3 days after birth and gets better on its own within a couple of weeks as the liver gets up to speed. Our goal today is to help you spot the difference between this super common, usually harmless jaundice and the warning signs of something more serious. So let's get right into our top 10 tips. Tip 1. Watch how the yellowing spreads. The first thing to watch for is how the yellowing appears and where it travels. Jaundice almost always starts at the top on the face and scalp. If bilirubin levels keep rising, that yellow color will slowly move downward in a head-to-toe pattern, from the face to the chest, then the stomach, and finally down to the arms and legs. A simple way to check is to gently press your finger on your baby's skin, maybe on their nose or forehead. When you lift your finger, if the skin underneath looks yellow, that's likely jaundice. This trick is especially helpful for babies with darker skin tones, where the yellowing might not be as obvious. And here's the warning sign for this tip. If you notice the yellow color has spread below the chest, and you can now see it on their tummy, arms, or especially their legs and the soles of their feet, you need to call your doctor. Yellowing on the lower half of the body suggests the bilirubin levels might be getting too high, and it's time for a professional to take a look. Tip 2. Check the whites of the eyes. Your baby's skin tone can be tricky to read, especially in different kinds of light. But the whites of their eyes, the sclera, are a much clearer sign. One of the most obvious signs of jaundice is when the whites of the eyes turn yellow. Unlike skin, which has all sorts of undertones, the whites of the eyes are a clean canvas, making that yellow tint easy to spot. This is often one of the first places doctors and parents notice jaundice. So, here's what you can do. Make it a habit to check your baby's eyes in good, natural light, like near a window, at least once or twice a day. If you see any yellowing there, or if you notice it's getting more intense, that's your cue to get in touch with your pediatrician. Don't wait for it to get worse. That sign alone is worth a phone call, just to be safe. Tip 3. Notice extreme sleepiness or difficulty waking. This tip moves beyond what your baby looks like and into how they're acting, which tells you so much about how they're feeling. A baby with severe jaundice can become extremely sleepy, lethargic, or very hard to wake up. Of course, all newborns sleep a ton. So what's the difference between normal sleepiness and true lethargy? A normally sleepy baby might take a second to wake up for a feeding, but they will wake up, they'll latch, and they'll eat. A lethargic baby is different. They're listless. They might not wake up even when you try to feed them, or if they do, they're too sleepy to eat and drift right back off. They might even feel floppy in your arms, almost like a rag doll. This is a major red flag. It can mean that high bilirubin levels are starting to affect the brain, a condition called acute bilirubin encephalopathy. If you find your baby is way harder to wake than usual, seems unresponsive, or is just too sleepy to eat, you need to get them checked out immediately. Tip 4. Pay attention to feeding. How well your baby eats is directly connected to jaundice. One of the main ways the body clears out bilirubin is through poop. And to have regular bowel movements, your baby has to be eating well. A newborn should be eating about 8 to 12 times in a 24-hour period. So, a big warning sign is when your baby just isn't feeding well. Maybe they're refusing the breast or bottle, having a hard time sucking, or seem too weak or tired to finish eating. If your baby isn't eating enough, they won't be pooping enough to get rid of the bilirubin, causing it to build right back up. On top of that, not eating enough can lead to dehydration, which can make bilirubin levels climb even higher. Try to keep a mental log of their feedings. Are they eating regularly and with energy? If you notice a real drop-off in feedings, or if your baby just seems uninterested or is struggling to eat, that's a red flag. When you see this change along with more yellowing or sleepiness, it's time for an urgent call to your doctor. Tip 5. Listen for a high-pitched cry. Your baby's cry is their number one way of communicating, and you get tuned in to their different cries pretty fast. The kind of cry we're talking about here is one that is unusually high-pitched, shrill, or just won't stop. This isn't their normal "I'm hungry" or "change my diaper" cry. A high-pitched cry linked to severe jaundice sounds different. It's piercing, and they often seem impossible to soothe. This type of cry can be a neurological sign, meaning the high bilirubin levels are irritating the brain and nervous system. This is considered a medical emergency. If your baby starts making a new, high-pitched, or inconsolable cry, especially if you're seeing other warning signs like intense yellowing or lethargy, don't wait. You should seek emergency medical care right away. We're halfway through our list, and you're doing an amazing job taking all this in. Parenting is definitely a learn-as-you-go journey. To help other parents out, I'd love to know, what's the one piece of newborn advice you've gotten that has been a total game-changer for you? Drop it in the comments below. Your tip might be exactly what another parent needs to see today. Now let's get back to it. Tip 6. Check their muscle tone and posture. This is another one of those really critical signs that bilirubin levels are becoming dangerously high. Pay close attention to your baby's muscle tone. Red flags include a baby that suddenly becomes very stiff and rigid, or the opposite, very limp and floppy. An even more alarming sign is an arched back, where the baby's head and neck bend backwards stiffly while their body arches. This specific posture has a medical name, opisthotonos, and it's a classic sign that bilirubin is affecting the brain. You might also notice strange eye movements along with this. Any of these changes, a stiff body, a floppy body, or an arched back, are signs of a serious problem. This isn't a wait-and-see symptom. If you see any of these changes in your baby's muscle tone or posture, you need to go to the emergency room or call for emergency help immediately. Tip 7. Keep an eye on urine and stool color. What comes out of your baby is just as important as what goes in. Their pee and poop are key clues about how well their body is getting rid of bilirubin. A newborn's urine should be colorless or maybe a very pale yellow. If you see that your baby's urine is dark yellow or brown, it's a sign that the bilirubin levels in the blood are too high. At the same time, look at their stool color. A breastfed baby's poop is usually a mustard yellow or greenish color. A formula-fed baby's is usually greenish mustard or tan. Stool that looks pale, clay-colored, or white is a major warning sign. This could mean there's a blockage that's keeping bilirubin from leaving the liver, which points to a different and possibly more serious type of jaundice. So, make diaper watching part of your daily routine. If you're consistently seeing dark yellow pee or very pale poop, it's time to call your doctor and get it checked out. Tip 8. Notice how long the jaundice lasts. While most normal jaundice is a short-term thing, jaundice that overstays its welcome needs a closer look. For a formula-fed baby, it should mostly be gone within 2 weeks. For a breastfed baby, it can sometimes hang around a little longer, maybe up to 3 weeks or even a month. This is often called breast milk jaundice. However, if your baby's jaundice goes on for more than 2 weeks in a formula-fed baby, or more than 3 weeks in a breastfed baby, it's really important to get them checked by a doctor. Jaundice that lasts this long can sometimes be a signal of an underlying issue, like a liver problem, an infection, or a metabolic disorder. Your doctor will probably want to run some tests to make sure everything is okay. So, keep a mental note of when you first saw the yellowing. If you're getting past that 2 or 3 week mark and your baby is still yellow, don't just assume it's normal. Make that appointment. Tip 9. Watch for dehydration and poor weight gain. This tip circles back to feeding, but focuses on the results. Diaper output and growth. Dehydration and poor weight gain are big deals on their own, and they make jaundice worse. Like we said, if a baby isn't eating well, they aren't clearing bilirubin. They also aren't getting the fluids and calories they need to grow. So how can you tell? Check their diapers. After the first few days of life, a well-hydrated newborn should have at least 6 wet diapers a day. A low diaper count is a classic sign of dehydration. You should also be seeing regular dirty diapers. Your baby should also be gaining weight steadily after that small initial drop right after birth. Your hospital likely scheduled a weight check for you a few days after you went home. If your baby isn't getting back to their birth weight or is losing weight, it's a sign that feeding isn't going well, which will make the jaundice worse. If you're worried about their diaper output or weight, trust that feeling and call your doctor. Tip 10. Know the emergency signs. This last tip is the drop everything and go list. It's a summary of the most urgent signs we've talked about. Sometimes you can just call the doctor, but other times you need emergency care right away. Go to the nearest emergency room or call 911 if your baby has any of these signs. An inconsolable, high-pitched cry. They are extremely hard to wake up or seem unresponsive. Their body becomes stiff, limp and floppy, or they arch their back and neck. They are making strange or unusual eye movements. They have a fever over 100.4 degrees Fahrenheit, 38 degrees Celsius. They have a seizure. These are all signs that bilirubin levels are dangerously high and could be affecting the brain, which requires immediate treatment to prevent permanent damage, known as kernicterus. Please do not hesitate. Trust your parental instincts. I know that was a lot of information, and trying to manage your newborn's health can feel completely overwhelming. But you are their best and most important advocate. While newborn jaundice is common and usually harmless, knowing these 10 warning signs empowers you to act quickly when it really matters. Just remember the key things to watch: how the yellowing spreads, what their eyes look like, and how they are behaving, their sleepiness, their feeding, their cry. You know your baby better than anyone. If your gut tells you something is off, or if you see any of the serious warning signs we talked about today, please call your doctor or seek emergency care. It is always better to be safe. You've got this. You are doing a wonderful job. If you found this video helpful, please give it a thumbs up and think about subscribing for more clear, parent-friendly advice. Thank you so much for watching, and take care.